Let's talk about the pharmacology of Versed. Well, you and I call it Versed here on TikTok and Instagram, but over on LinkedIn, it's referred to as midazolam. But Versed, let's start with the mechanism of action. It works by enhancing the effects of GABA. And if you remember, we've talked about GABA before. GABA is a neurotransmitter that helps us to balance the let's speed things up versus the let's slow it down. And GABA helps to slow things down. So we're potentiating the effects of that GABA. And so it makes sense that we use this for our patients who are seizing. We use it for patients who are agitated, who require some sedation, but it's not without its untoward effects. Yes, I love this drug because we can give it almost any route. Of course, we can give it IV, IO, intramuscular, intranasal, so many ways if you don't have access and you need to get it on board quickly, say if your patient is seizing or they are coming out of their skin with tons of anxiety or agitation. But one of the effects of it is it can cause respiratory depression, especially when we're combining it with other medications like opiates or if the patient already has alcohol on board. So use it with extreme caution if you don't have airway control on this patient, if you're also using analgesics, because it's important to know that Versed does not provide any analgesia. So when I'm using this for continued sedation on my intubated patients, say I'm on a flight on the helicopter, I like to go back and forth between maybe using a little bit of fentanyl and 10 minutes later give them a dose of Versed and go back and forth so that I'm providing that analgesia and that sedation that I'm trying to achieve. But just be aware, if your patient isn't intubated and they've got some other drugs on board, you're highly likely that you're going to get respiratory depression. In addition, we know that it can cause profound hypotension, especially if we're using some larger doses. Now, sometimes I use this to my advantage. If I have a patient who's intubated and I'm trying to achieve that sedation, but they are also hypertensive, I'll use Versed more than I might reach for ketamine or another drug so that I can use those side effects to my advantage to help bring that blood pressure down. So there's just a little bit of information about Versed or midazolam if you're one of those LinkedIn people.